Seeking prompt help for depression. Rather than living in denial, if you are experiencing a depressed mood that refuses to lift after several weeks, it is best interest to seek diagnostic from a qualified psychiatric or other licensed healthcare practitioner. When this course of action is pursued, you are taking a proactive approach to helping yourself find a solution to your depression. Instead of becoming a victim when you realize you are battling the disorder, educate yourself on the various types of depression that exists and ask your doctor or psychiatrist to explain in detail the type of depression from which you suffer. The many phases of depression. Although many forms of depression exist, the symptoms they are associated with often overlap. Following are several types of depression from which an individual may be suffering. Bipolar disorder, also called manic depression, is categorized by extreme emotional changes and mood swings. A person suffering from manic depression experiences cycles of euphoria followed by periods of depleted depression. Such mood swings may follow a daily or weekly cycle. In some cases, a person may remain in a state of mania for several months, followed by a severe months of melancholy. Postpartum depression occurs after the birth of a child and is quite different from the natural mild depression that some new mothers experience. The latter typically lifts very quickly and not in severe nature. However, postpartum depression is considered a major depression and is categorized by a feeling of profound sadness, emptiness that one cannot overcome. Dysthymia is considered a very mild form of depression and is rarely duplicated in nature. However, it can be prevented from functioning at an ideal level and still requires treatment in most cases. Cyclothymia is another mild form of depression that mimics bipolar disorder, but the mood swings experienced with this condition are much less severe than those seen with manic depression. Seasonal affective disorder, as its name implies, is a form of depression that afflicts certain individuals during specific seasons. Such individuals typically feel normal during spring and summer, but spiral into depression during the fall or winter when less sunshine is available. Researchers are currently studying the link between the disorder and low levels of vitamin D. The importance of seeking treatment. Help for depression is available, though you may initially feel overwhelmed when you begin seeking treatment. However, the road to recovery can be made a bit less daunting if you attempt group therapy sessions where you can interact with other patients who are struggling with the same condition. You should also seek support from your family and friends. Your doctor will typically prescribe counseling, medication, cognitive behavioral therapy, or a combination of all three. It is also wise to set realistic goals regarding your condition, as it does little or no good to set yourself up for disappointment by having unrealistic expectations. It is far better to follow the treatment program outlined by a doctor or psychiatrist and take one day at a time, with the goal of making each day better than the last. If you want more information on this, I have a free book which you can download by visiting www.gsdirect.co.uk/beat depression, as you can see on the screen. It's a free ebook, a free gift for myself to help the people who are suffering depression.